Meantime, the head of Jackson Health System sounding a really dire warning about the pandemic.
His letter to employees sounding ominous for the future of the hospital. Local 10's Glenna Milberg is here live to explain.
Christy, you know, the dire warnings have been coming for everyone across the nation, and common sense would tell you that hospitals on the front line of this pandemic are feeling it first and feeling it worse. But today we're getting a look at an internal memo that the president and CEO of Jackson Health Systems, Carlos Migoya, sent to the staff. This is one of the county's largest employers, and remember, the public taxpayer-funded hospital. So this is a really interesting look at the steps that he wants to take to mitigate the crisis within. So first, let me give you a look at the letter that the employees are receiving today, and some did last night. It actually starts with acknowledgement of their work and gratitude for that. And then Migoya does paint a fairly dire picture of the foreseeable future. He literally says that the situation will get worse before it gets better, that COVID-19 cases are still climbing toward the top of the curve. We have not reached peak yet. He uses the words unbelievable financial strain, mostly because one of the mitigation efforts that they're doing is canceling elective surgeries to free up beds, but also declining sales tax. Miami-Dade's sales tax is a source of revenue for this hospital.
So our medical teams are on the front lines every day battling this global public health crisis. They are courageous and admirable, and I commend every healthcare worker who is giving it all they have during these challenging times. This coalition of hospitals that we're working together, we're assessing the number of beds we have available.
So Migoya is actually talking about South Florida's hospital as a whole, not only the public hospital. The employees here who are not medically oriented, who are not working the front lines, the doctors, the nurses, the patient care technicians. In that letter, he is asking all non-medical staff to take off, to take their vacations, to take their personal leave, to take one for the team, essentially to lessen the financial burden. We are talking to a couple of people who are just getting this. One of the employees said he got the letter. He's not sure if he's going to be able to do that. He's looking at his own future. But this is the kind of look at internally what Jackson is doing to mitigate these dire financial costs that are mounting with this pandemic, and taking sort of proactive approaches to protect the operations of this public hospital. I'm Glenna Milberg, live at Jackson today in Miami, Local 10 News.